Which mask is best for protecting against coronavirus? The world is getting sick these days, and that's why it's trying to use the best equipment to prevent it. The World Health Organization has also emphasized the use of masks. That's why in this part of Healthy, we're going to introduce you to the different types of masks that are available these days. You'll also find out at the end of the video what features each mask has and which one will be most appropriate. Kalmihupen is one of the most famous medical product factories. The plant, under natural flows, produces facilities for the treatment of respiratory diseases, including masks. The factory in France produces 150 million surgical masks and 20 million respiratory masks annually. It has now increased its production to 500 million with increasing demand. These days, many people in the world are rushing to pharmacies to buy masks. There are, of course, different types of masks, all of which are not effective against the virus. That's why you need to know enough about them, so be sure to observe this part of Healthy. Surgical mask and mouthpiece. There are two different types of masks, surgical and respiratory masks. If you intend to care for a patient with coronary artery disease, it is advisable to wear a surgical mask. These masks should be used in environments where the patient, surfaces and equipment are infected. However, the use of this type of mask should not exceed 3 to 8 hours. The surgical mask will also protect you from exposure to biological fluids. The surgical mask in such cases should have a waterproof layer, and also the edge of the mask should protect the eyes. Of course, a surgical mask will not protect you against infectious agents transmitted in the air, such as the coronavirus. Respiratory masks or mouthpieces are divided into two categories: filtered and insulated masks. Filtered masks have a face part and a filtered part. Sometimes these two parts are completed together. Depending on the type of filter, this mask can only resist components such as certain gases and vapors. Sometimes the filtered breather mouths are also equipped with a breathing tube, which is easier for the user to use. This tube prevents the concentration of air inside the mask and will help breathe easier. It should be noted, however, that respiratory glands also protect people against infectious diarrhea. In the latter case, the filter can be removed when the mask is filled. What are mask standards? Each of these types of masks have different standards, and their laws vary depending on their country and geographic location. For example, European countries have to comply with EN 14683, which has 3 levels of bacterial filters. In the United States, they must also make masks in accordance with ASTM standards. This means that the masks must protect the person from the risk of exposure to infectious liquids. Standards for respiratory mouthpieces include a number of cases. FFP1 refers to filter masks whose filters must be at least 80%. Its maximum internal leakage should be 20%. This mask is basically used as a shield for dust. FFP2. These masks have a minimum filtration rate of 94% and an internal leakage of up to 8%. These masks are mainly used in construction, agriculture, and medicine against influenza viruses. These masks are now among the best against coronavirus. FFP3 masks have one of the highest levels of mask filters. Their filtering percentage is minimal, 99%, and their internal leakage is 2%, and protects the individual against components such as cotton. There are also other types of respiratory masks, which are classified by fat and oil resistance as follows. Class N, no fat and oil resistance. There are N95, N99, and N100 variants of this mask. The number after the letter N corresponds to the filter percentage of these masks. Class R, these masks are resistant to fat or oil for about 8 hours. Their variants are R95, R99 and R100. Class P, it is a completely oil and grease resistant mask. Its variants are P95, P99 and P100. Which mask protects you against coronavirus? When a person has coronary artery disease, he or she should use surgical masks as soon as possible, so one of the best masks against coronavirus is surgical masks. In European countries, people who take care of patients use FFP2 or FFP3 respiratory masks with maximal filtering. In some countries, N95 respiratory filters with 95% filtering are used to filter out viruses and bacteria. Caregivers must also wear N, R, or P breath masks. Are disposable masks better or multipurpose masks? Surgical masks are disposable, which must be disposed of once they are disposed of, but respiratory masks are available in both single and multiple use types and can be changed to filter. The brand of masks is also important in their effectiveness and also in their use. In general, these masks are generally used for about 3 to 8 hours depending on humidity, temperature, respiratory volume, and so on. If people using mouth masks with gas filters inhale the odor of gas, they should leave the workplace immediately and replace the mask filter.